The American healthcare system stands at a crossroads, a fragile colossus burdened with inefficiencies, corruption, and an overwhelming sense of disillusionment. At the heart of this massive machine lies the Centers for Medicare and Medicaid Services, or CMS, an institution responsible for overseeing the care of over 160 million Americans and managing an annual budget that surpasses $1.5 trillion. And now a new leader has stepped in, determined to reshape its future. Dr. Mehmet Oz, once known to millions as a prominent heart surgeon and television personality, has now taken on a role far more demanding and consequential, the head of CMS. From his very first day, Dr. Oz made it clear, this isn't just a bureaucratic post, it's a mission to save what may soon be unsalvageable. In his words, the most expensive care is bad care. It's a sobering reality. When care is done wrong, the system pays for the initial mistake, then again for someone more competent to fix it, and once more for the complications that follow. The result is a cycle of waste, a system hemorrhaging money while the most vulnerable patients suffer. For too long, this has been the norm, but Dr. Oz believes it doesn't have to be. He's not interested in band-aids or surface-level reforms. What he's talking about is a full-scale transformation, one that empowers patients, incentivizes providers to do the right thing, and finally puts an end to the perverse mechanics that reward failure. In the current system, providers are often paid more for doing things wrong than for getting them right. That reality is no accident. It's the product of outdated structures and a lack of will to confront entrenched problems. But now, change is on the horizon. Dr. Oz has declared war. Not a metaphorical war, but a literal campaign against fraud, waste, and abuse. He calls it an all-hands-on-deck moment, a fight against what he believes are hundreds of billions of dollars being lost through mismanagement and exploitation. In a building where historical names echo through the halls, Bobby Kennedy, Hubert Humphrey, Dr. Oz is now bringing those ideals into the present. The idea that a society should be judged by how it treats those in the dawn of life, the twilight of life, and those living in the shadows is more than just a quote on the wall. It's the principle guiding this administration's every decision. The details are staggering. $1 billion in Medicare funds went missing, allocated to people who were enrolled in Medicaid across multiple states at the same time. Hundreds of millions went to housekeeping services. $10 million were used to pay off student loans under Medicaid. $3 million for diversity, equity, and inclusion initiatives. $11 million funneled into union child care benefits. Even more shocking, nearly 250,000 people registered in the healthcare marketplace weren't eligible to be there in the first place. It's enough to make anyone pause and ask, how did we let this happen? But Dr. Oz isn't just diagnosing the problem. He's mobilizing. A war room has been set up within CMS, staffed by analysts, investigators, and experts whose sole purpose is to hunt down fraud and recover lost funds. This is more than policy. It's a national security issue. Some of the scams, he says, aren't just from opportunists. They're being orchestrated by foreign governments and criminal networks. And it's not just about numbers on a spreadsheet. Every dollar lost is a treatment denied, a senior left waiting, a child without proper care. And yet, amid all of this, a chorus of criticism rises. Political opponents claim the administration is cutting Medicare and Medicaid. They warn that vulnerable populations will be left behind. But Dr. Oz responds with a firm and unshakable promise. Those who the programs were originally designed to help, children in poverty, pregnant women, the elderly, the disabled, will not be touched. If anything, they will be better protected. Because if the fraud continues, if the waste grows unchecked, those very people will suffer the most. That is the true threat, not reform, but inaction. He recounts the words of President Trump, who made it clear that Medicare and Medicaid should be cherished, not gutted. That's the mission, to preserve these programs by ensuring they work as they were meant to. Not as cash cows for criminals, not as bloated bureaucracies funneling taxpayer money into untraceable voids, but as safety nets that actually catch people when they fall. Already the campaign is showing results. Tens of billions in fraud have been identified. In 1 week alone, $31 million were caught before they could disappear. It's not just oversight, it's strategy. By modernizing systems and using smarter data analytics, CMS is starting to spot the red flags before the money vanishes. And it's not isolated incidents. This is widespread systemic abuse that requires a coordinated, relentless response. Dr. Oz isn't doing it alone. He's calling on every American. If you see something, say something. Call the tip lines, report suspicious activity, become a part of the movement. This isn't just government's responsibility, it's a national one, because the stakes are too high to stay silent. And while the scale of the problem is immense, so is the potential for change. There's no sugarcoating the challenge ahead. Reforming CMS won't happen overnight, but for the first time in a long time, there is real momentum, real leadership. And it's rooted in a belief that America is too great for small dreams, that we can not only save our healthcare system, we can make it stronger than ever. The journey will be long, and the resistance will be fierce. There are powerful interests who benefit from the way things are. But if the mission succeeds, millions of Americans will feel the difference. Better care, more efficient services, a system that serves the people, not the other way around. This is more than politics. It's about moral responsibility. It's about protecting the sick, the poor, the forgotten. It's about restoring faith in one of the most important institutions in American life. And it's just getting started. If this resonates with you, if you believe in rebuilding what's broken, share this message. Subscribe to the channel, join the conversation, because the war to save American healthcare is underway, and we all have a role to play.